I am Jane Demo. I'm a marketing specialist here at Zoll Respicardia. I'm joined today by Michelle Sotek and Christine Walker. They are part of our what you would call market access or insurance part of the Respicardia team, and they're here to talk more specifically about the patient considerations with insurance. So they also handle, the reimbursement on the hospital end, but just in regards to any questions that patients have or potential patients have about what the insurance process may consist of, how to get prior authorization or approval for getting the remedy system, things like that. So they're going to walk us through what that looks like for each insurance provider, as there are several different types, and depending on what you have, they may be able to address any questions that you have. I will say that we have a question and answer segment at the end of this presentation. So if you have any questions as we go along, please feel free to enter them into the Q&A portion. It should be on the ribbon on the bottom of your screen. Just click on that icon and enter in your question. I do advise that you don't enter in any personal information. We are recording this webinar to share at a later date. So just refrain from entering any personal or confidential information there. If you have questions about your particular case and would like to reach out to our team, you can do so by using the links in the chat. You can do it through email, or feel free to reach out to us by phone. So you can either reach out to the reimbursement team or the patient educators. They're also here to help you guys answer any questions you have about your particular case. So with that, let's get started into the remedy system and insurance consideration overview webinar. So I do want to discuss some important safety information as the remedy system is indicated for moderate to severe central sleep apnea in adult patients. So please consult your doctor to see if remedy is right for you. This is not by any means a diagnosis webinar or anything like that. We're not providing any medical advice. This is just an information about the insurance and a little bit more about the remedy system in the beginning. And with that, I will turn it over to Christine and Michelle. Thank you guys for joining today.
Great. Thanks, Jane. I will let Christine take us through the slides, but just as a quick introduction, I'm Michelle Sotek. I'm the Market Access Director for Zoll Respicardia, and I'm joined by Christine Walker, who's our Field Reimbursement Manager. Jane has very kindly put our reimbursement hotline number and email in the chat. We will be covering general insurance coverage and topics today, but if you do have any specific questions about your situation, feel free to email us at the reimbursement email that you see in the chat, or you can reach out to the patient educators as well, and we're happy to talk through more specifics about your individual situation. So with that, Christine's going to go over some background of central sleep apnea, talk a little bit about remedy, and then talk about the different types of insurance coverage you may have and the general process for seeking coverage for remedy. And we should have plenty of time for Q&A, so feel free to put those questions in the chat or ask us individually. So, Christine?
Great. Thank you. Hi, as Michelle and Jane mentioned, I'm Christine Walker. I'm the Field Reimbursement Manager. So I am going to start with a very high-level overview of what central sleep apnea is and the remedy system. Then we'll dive a little bit deeper into getting the remedy system, as well as looking at your insurance providers. As they have both mentioned, if you have specific individual questions, I can't necessarily answer those, but I'd be happy to kind of answer some general questions, and we'll have plenty of time. I do tend to talk fast, so if you have any questions, please chime in. And moving along, is that you? All right, so what is central sleep apnea? If we hear the word sleep apnea, oftentimes we either know someone with, or what we're most familiar with is obstructive sleep apnea. And that occurs when there's an obstruction or a blockage in the respiratory. You're not able to take a deep breath because there is a blockage, causing restriction to oxygen in the body. Central sleep apnea is fundamentally different in that what happens in central sleep apnea is that the brain is not communicating with the diaphragm to take regular breaths throughout the night. And again, just still not taking those regular breaths could stop breathing throughout the night. So either way, how sleep apnea can affect your health is just, it can really take quite a toll on the quality of your life. So you could notice that chronic fatigue, excessive daytime sleepiness, really where you're having that brain fog. And this is on a daily basis. You could have trouble sleeping throughout the night, of course. There are many long-term problems, as you can see. I won't list the whole list here, but there can be many complications of sleep apnea as well, long-term. So what is this, the remedy system, and how can it help with the central sleep apnea? Well, the remedy system, it is an implantable pulse generator. It is placed in the upper chest during a minimally invasive outpatient procedure by an electrophysiologist. It has as I said, a pulse generator. It also does have a stimulation lead that leads to the diaphragm, and it really basically forces the body to take regular breaths throughout the night. So during sleep, it doesn't turn on throughout the day. Once this is implanted, you will go back to your sleep physician, where it will be for your regular sleep hours. And once you're laying down, it will turn on. And then if you get up to go to the bathroom, it'll turn off and back on once you lay back down. So it does turn on automatically at night when you're falling asleep, and it does help with breathing throughout the night. So what is the effectiveness of the remedy therapy? It really is, so we've shown a 96% reduction in the central apnea index, and 88% of the patients had a reduced number of sleep apnea. 78% of the patients had an improvement in their quality of life, and 95% of the patients said they would get remedy again. Not to just read those, but where patients who have had the remedy system have had great success. All right, what you're most likely here for is really how do we get the remedy system? What is that going to cost me out of pocket? Well, again, that's going to be really dependent on the terms of your insurance coverage. So that means what is your deductible amount? What is your maximum out of pocket? Is your physician, your implanting physician, in or out of network? And also, who's your insurance provider? So all of this can, determine what your out of pocket may be. And you can work with your physician before anything happens to really work that out. We'll talk a little bit more about what that process is, but you should know what that out of pocket cost will be to you before you go in for your procedure. All right, before diving in, I just wanted to go over a couple key terms that I will keep talking about, and just so you know. So prior authorization, you may or may not have heard before. It's also known, you may hear it from the doctor's office, as predetermination, pre-certification, prior approval, pre-notification. So all essentially the same thing, that you do have authorization to have the procedure before that your insurance company will cover this procedure. And that's before the procedure happens. So you want to seek that prior authorization for the most part before your procedure happens. And they will be oftentimes medical necessity. So if you hear that word medical necessity, it's used by the health insurance companies. It describes the coverage under a benefit plan. That's what it says here. Really, they're looking for the reasons why exactly why you would need this procedure. So how this is affecting your quality of life, maybe other therapies you've tried and failed, those kinds of things will be, they will be looking for medical necessity. All right, well, let's look at that prior authorization. There's really a three-step process. So first you will be consulting with your doctor to really determine if that remedy is right for you. You truly have central sleep apnea, and you have both decided this is the right procedure for you and right therapy for you. The next step would be to that your medical center will seek prior authorization, and we'll discuss that a little bit more, which insurances really need that prior authorization. But once you have that prior authorization, then the physician can go ahead and schedule your procedure. And that would be the third step. So again, determining if the remedy system's right for you, then your physician will seek prior authorization, and then that last point would be to schedule your procedure. I'm going to break down the different insurance types and really what they are, each one is looking for. So the first block is that private insurance. You may also, sometimes we call it commercial insurance, as well as Medicare Advantage. And then there's Medicaid is kind of in that first bucket. Medicare's in that second bucket, and then the VA's in that last bucket. So when we break it down, and if you have that private or commercial insurance, you have Medicare Advantage, or you have Medicaid, then what your provider will need to have a prior authorization. So there's a couple ways to look at coverage. There can be an established coverage policy with certain insurances. However, that usually happens with this new technology several years after the FDA approval. So there can be an established coverage policy. However, you still will need a prior authorization. You want to make sure. So if you have that, again, just to reiterate, commercial insurance, Medicare Advantage or Medicaid, you want to make sure that a prior authorization is in place. And if there is not an established coverage policy for your insurance for the remedy system, most insurances will review the remedy system on a case-by-case basis. And as I mentioned, that medical necessity, your physician will need to show that medical necessity. So that you truly have central sleep apnea. These are just a few things. How this is truly affecting your quality of life. And, other therapies you may have tried and failed, or even just refused to try at all. So those are the kinds of things that they will need to show with that medical necessity. Okay, if your prior authorization request does get denied, an appeal may be filed, and each insurance is a little bit different. There are a few levels of appeal that can be done. We do offer, Respicardia does offer a remedy patient access program facilitated by Priya Healthcare, and they do and can help patients to pursue that prior auth approval. They do work on behalf of the patient, and to date, we've had more than 75% of our cases have been approved when this appeal process has been fully pursued. If your facility or your physician is using the patient access program that from Priya, again, really just to go over that real quick, they are a third-party program that we've used. They are used to working with the new lower volume technologies, such as the remedy system. They do work on behalf of the patient. And they will pursue all levels of appeal until everything's been exhausted. So that is an option as well. It's provided at no cost for the patient or the providers, and that is PRIA Healthcare. Okay, so if you're in the next bucket and you do have Medicare, what you can expect is that there is no prior authorization needed for Medicare coverage. Medicare does follow a policy of presumption of coverage when we have shown medical necessity, again, is what they are looking for, just showing documentation of medical necessity. Again, as I mentioned, sleep studies, results, symptoms you may be experiencing, and previously tried therapies, how this is affecting your quality of life. So those are the things that they'll be looking for, but no prior authorization is needed for if you do have Medicare coverage. And we've had great success across all jurisdictions for Medicare.
Christine, just to jump in on that, so I know this can get a bit confusing sometimes depending on the type of coverage you have. So the main difference here is what Christine just referred to is if you have what's called traditional Medicare coverage, or you might know it as Medicare Part A and B. In that situation, that is when, as Christine just mentioned, your doctor does not need to get a prior authorization before the remedy procedure. The difference is if you have Medicare Advantage, which may be through United Healthcare, Blue Cross, some other type of insurance company. In most cases, even though it is a type of Medicare, you still will need to go through the prior authorization process with your doctor. So there is a bit of a difference there depending on what you have, but your doctor's office knows the difference and will be happy to work with you through the process.
Thanks for clarifying that, Michelle. It can get confusing with that Medicare Advantage. It does sound like traditional Medicare. So yep. Great. And then moving on to our last bucket, which is if you have the VA benefits. So if you are at a VA where the remedy is offered and your doctor can determine if there is a prior authorization needed or not. If your VA doesn't offer the remedy system, you can talk to your doctor about getting the remedy through that community care program. So again, we've had great success with the VA. And again, we do have a link here to see if your doctor is in the system, is utilizing remedy. All right, so I'm just gonna reiterate what we just went over. So if you're in that bucket of private insurance or commercial insurance, Medicare Advantage, and to Michelle's point, that could be, United Healthcare, Medicare Advantage. It could be Aetna, it could be Blue Cross Blue Shield, Medicare. Or if you're in that Medicaid bucket, then your physician will need to have a prior authorization in place before the procedure is done. They will be looking for proof of medical necessity, and PRIA can help with these if that's of interest to your office. If you do have traditional Medicare, you will not need a prior authorization, but you will, and your physician will need to show that proof of medical necessity. PRIA does not help with Medicare since there is no prior authorization needed. And again, that last bucket, the VA, typically a prior authorization is not needed. Sometimes they may or may not need that proof of medical necessity, but PRIA can help with the VA insurance as well. All right, so what can you do? You can talk to your doctor, see if remedy's right for you. Everyone's insurance is different. Sometimes you even see the same insurance, but it may have a different type of coverage. So it's really, you can call your insurance and ask about coverage, so you can have a little bit of say in what's going on. And then if you do have insurance through your employer, you can ask your HR or benefits team for assistance, you can really see if they can help out with just finding out what is going to be your out-of-pocket costs, if it's going to be covered, those kinds of questions. And I think that's it. But you know, you can call your insurance as well. I just like to reiterate that you can have, not that you have say, but you can find out a little bit about what might be needed for your remedy procedure. All right, so in summary, yeah, you just want to make sure that you determine whether your insurance, once you know you've and your physician have determined that the remedy system is right for you, you want to make sure your insurance will cover it. That's going to be your first step. So we do have a list and a link here. I know Jane's listing that as well as far as physicians offering the remedy. Your care team will work with you as far as really filing that prior authorization request, getting that approval for, again, your commercial insurance, your Medicare Advantage, or your Medicaid plan. So work with their team. And then if again, just to remember, if a prior authorization request is denied, there are many avenues. There's you know, keep pursuing and insisting, and your office keeps pursuing that prior authorization appeal. So last, we do know insurance can be confusing. We know each insurance, even if they fall in certain buckets, can come up with, you know, just different things. So we are here. If you have any questions, just make sure to reach out to us, and of course talk to your doctor and your doctor's office, and they can also really help with your insurance, your kind of plan moving forward. So other than that, I think we're ready for questions and answers. And
Yeah, absolutely. Thank you so much, Christine and Michelle. If you do have any questions, please enter them into the Q&A section. I'm only able to enter our links into the chat. So that's if you're wondering why you can't enter your question into the chat, that's why you enter it into the Q&A portion. So yeah, let's take a look at these questions here. Yes, we will be able to send more links by email. So if you have any questions or need access to the resources shared in the chat, we can definitely follow up and send those by email. Dismiss that one. What is the cost of the system upfront and on an annual basis? So I'm not sure if Christine or Michelle, whichever one of you wants to take that.
yeah, absolutely. Oh, go ahead, Michelle, if you have.
Sure, you can chime in. So the cost of the system is a bit different. So there's no really direct cost to a patient. It's the cost is to the hospital and to the facility that's doing the procedure. As Christine said, the out-of-pocket cost that patients may see is dependent on your type of insurance coverage, your deductible, your out-of-pocket maximum, all those types of things too. So it's difficult to give an exact amount, as it's going to depend on each person's situation.
And then another follow-up question, how long does it usually take for approval?
That's a great question. I have to say it's going to be a little bit insurance dependent as well. So we've seen some get approved in as little as a week or two. I would say typically to kind of plan on 30 to 45 days. You know, if you have one prior authorization denial and then maybe an appeal, it can be even longer than that. So that's what we do suggest, waiting to schedule your procedure until you have this prior authorization approval.
Thank you. Going down here, what if there isn't a doctor in your area that places them? I'm 3.5 hours away from a doctor. So that's in reference to the Find a Doctor tool, I think that they're referencing on our website. Yeah, unfortunately, like we mentioned, these are implanted by a Remedy trained facility, and they're familiar with the therapy, they're familiar with the insurance process. They go through a lot of training with us, and are familiar with the treatment and therapy itself, and titrations or optimization appointments that you have following the procedure. So not everyone is able to implant this system yet, unfortunately, but we are always working to grow our amount of centers that are able to implant this device. And that list is growing pretty much every month. So hopefully, if you have a center that's too far, we can follow up with you when one becomes available within a comfortable driving distance. That's always important for those follow-up appointments. Can my sleep specialist who is not on the list for Remedy providers work with a Remedy provider, or do I need to switch doctors? That is a great question too. Typically, we are able to work with your sleep doctor by having them refer you to a Remedy provider. Yes. Are there any medical concerns, such as cardiac symptoms, that would prevent approval of the implantation? Michelle or Christine, I'm not sure if you've seen anything come across on that for getting approval for this procedure.
No, typically the approval is not, if your doctor determines that Remedy is right for you, they note any other conditions that you may have in the information that they provide to the insurance company. And Jane, you can speak to this probably better than I can as well, but we do have quite a few patients on Remedy who have other, say, cardiac devices like a pacemaker, things like that as well. So that situation is quite common.
Absolutely, yeah. Our contraindication is an active infection. So that if you have, heart failure or atrial fibrillation, that's not going to prevent you from getting the device or the implant. But we will do, additional testing during the implant to make sure that there's no interference between the devices. Do insurers typically require you to try CPAP for a period of time to qualify? And well, I'll do that question first, and then I'll do the follow-up.
Sure. And that's a great question. So we do see some insurance companies, again, it depends on the type of coverage and the type of plan that you have. We do see some insurance companies that do state things like patients must have tried and failed, or tried or be contraindicated for other types of therapies, including CPAPs. So that may apply. Usually by the time that patients are being evaluated for Remedy, most people have gone through other therapies as well. So that is not usually something that's kind of an extra step in the process. It's more just having your doctor make sure to note all of that in their information they're providing to the insurance company.
And then a follow-up on that, does CPAP work well for central sleep apnea? I'm not a medical professional. I cannot answer that fully, but I think that's up to your sleep provider to determine that treatment and which therapy would be right for you. All right. Would my sleep doctor team work out of network? I'm thinking that this is the referral, a second part of that referral. So if you go through your sleep doctor and they refer you to a Remedy center, I think typically they would try to get one within your network. I'm not sure, Michelle or Christine, if you guys have worked with any sleep doctor that has referred to a Remedy provider instead.
I think the out of network piece certainly is a concern, and this is also why it's very important when you're talking to both your sleep physician and to the cardiologist that they may refer you to discuss the remedy procedure is to confirm, have them confirm, and then you can confirm as well whether they are in and out of network. As certainly out of network coverage with people's insurance plans does vary quite a bit as to how much that may be out of pocket for you and whether that may be covered. So that is definitely an important consideration to determine whether someone is in or out of network for you.
And then does the remedy system require a battery change every 10 years? I will answer that. So the remedy system, it actually is a little bit less. So, and it all depends on the therapy settings that you have. So how much energy is required to deliver that therapy and capture all of those central events and treat them. So, you know, that definitely is taken into consideration, as well as how long you sleep during the night, so that sleep window. But we're seeing, I believe it's up to, dependent on your settings, it's up to 5 to 6 years, I believe. And then we see typically a device change out. So you would go back into for another follow-up procedure and just change out the device. So the lead would stay in place. So the procedure typically takes a little bit less than the initial one, and you just swap out that device itself, and then you're good to go. We've had several patients already get a change out. Some of them even have more than one, so they've changed out a couple times. But yeah, you would need to go back in and get that device changed out to make sure the battery lasts. How big is the device? So that is going to be, I think, a good example
That
is
one,
about.
if you can
Oh,
see it, it's it might be a little blurry, but it's smaller than the palm of my hand, basically. So it's quite small. It's planted in the, like, up here, upper chest.
yeah, we usually say it's about 2 by 3, so about the size of a business card, I'd say, just for reference. So sometimes that's always a good marker, but yeah. And then, can you have an MRI with a remedy system installed? Yes, it is MRI conditional as of last year. So you would work with your physician to make sure that your device is turned off, the therapy is turned off before getting an MRI. And there is, of course, MRI documents on our website. So if you do have a procedure coming up, we typically work with you and making sure that your MRI technician knows that you have a remedy device implanted. That's very important, so that you have those appointments before and after your MRI to get it turned off and turned back on. All right. Yes, if you do have questions about the implant or the procedure, we do have webinars with patients that have been implanted with the remedy system. So if you want to connect with them, or if you want to hear their stories, we have multiple opportunities for you to either connect with them directly or just attend the webinar and hear from them and their experience with remedy. And some of them, like I said, have gone through the change out for the battery. So you can definitely listen to their story. Do you need a bracelet for TSA security entry? Oh, that's a good question. A lot of our patients have like a card. It's like a implant card that they show that they have the device implanted, and then they kind of avoid that scanner. But yeah, it's a pretty straightforward, for airport security, and many people travel with devices now, so it's pretty common. Is it a reversible procedure? That is a good question. I may have to, I'm not sure if Christine or Michelle, if you've ever heard of any procedure that they reversed it.
Yeah, so it can be explanted, so it can be taken out if needed. So as Jane mentioned, it's very common that you may need the device itself changed out because of the battery. So that's kind of a swap of that. But if for some reason the leads that go into the veins need to be taken out, that can be done as well. It is an outpatient procedure like the implant procedure itself. So that's how they would remove that.
And then I'll jump in and say the recovery time after implant, how long, just because, as Michelle said, it's an outpatient procedure. So typically we have advice as far as like right after the procedure, so post-op advice on our website. So it talks through like what to do for the next, couple days. Usually we advise wearing your arm in a sling for that side that's been implanted, so that just to maintain or limit your arm movement and make sure that you're not going to dislodge that lead. It needs time to heal. So I can definitely share that link in the chat as well, so you can see more information about post-operation procedure and advice. But yeah, I mean, other than that, many of our patients have recovered rather quickly. It's just that like 4 to 6 weeks of taking care of that implant and making sure that lead doesn't dislodge. Let's see, is it visible when it's implanted? I think it depends on your body type. So many of our patients, they vary in size and height, but you can see it underneath the skin if you're looking closely. But a lot of our patients that come to our events or speak at our physician educational seminars, they will wear a polo and you can't tell that they've been implanted. But you can definitely speak with them, one-on-one if you have more concerns about how it might look. And then I had a sleep study 8 years ago and now have been referred to a doctor that does remedē. I have an appointment in 2 weeks. Do they usually need a sleep study again? So I will say, just from my experience and our patient education team experience, they want a sleep study within the last 2 years. Michelle or Christine, I'm not sure if you've experienced differently, but that's usually the recommendation. And oftentimes we also find that the remedē doctor or physician that implants the device will need to see that recent sleep study just to make sure that the therapy is right for you and they can optimize, your settings and everything from the beginning.
Yeah, exactly.
Do we have any photos of one of the patient with the implants? I'm imagining like a close-up photo or what it might look like. I don't know of any, but I'm sure I can think of a few patients that would be more than happy to share information and what that might look like, and we can connect you guys with them, definitely. Are there visible scars? Again, that depends on each person. Often there's an incision scar that's pretty common of any surgery. But yeah, I'm going through the rest of them. Is there a possibility of ongoing muscle pain after implantation? I can't really speak to that. I don't know of any experience with any of our patients with like post-operation pain, or any muscle pain after the implantation. But every person is different. But any like long-term effects, they they've they go away. Sorry. I'm trying to think. I'm trying to think on our clinical data. And let me see if we have any other questions coming through here. I don't see any questions. So if we have not answered any of your questions, or you want some more information or more clarity maybe on the questions that you've asked, again, feel free to email us directly. You can either reach out to our reimbursement team if it's related to insurance or prior authorization. If there's any questions about the remedē therapy or the device itself, our patient education team is definitely here to help address any of those questions or concerns. And like I said, our patient ambassadors are patients that have been implanted with the device itself, and they can speak to, really everything that a patient would know about the device. So what it feels like, the implant procedure, the recovery time, how their life looks now, things like that. So if you have questions as it relates to patient experiences, we can definitely help connect you with those patients. But otherwise, I'm not seeing any more questions come through. So I will take a moment to thank Michelle and Christine for having us today and sharing this information with anyone that's interested in the remedē system and what the insurance process might look like. As Christine mentioned and Michelle mentioned, insurance can be a little overwhelming and a little complicated because there's so many providers. So thank you both for walking us through. And again, if you have any questions, just feel free to reach out to either resource.